Hi, I am Caitlin over here at TherapyWorks, and I'm joined today by James Quinn, one of our awesome physical therapists. Thanks so much for waiting, you guys. I know that we're a few minutes behind where we meant to start. We had a few technical difficulties on this end, but they're all figured out, and we're glad to see you. So today we're going to be talking about hip pain, which is one of our top 5 most common things that we treat here. So James, could you tell us a little bit about why it's so common?
Definitely. I'm really good with hips, computers, not so much. Thank you. Yeah. Hip is just a big, it's really the hinge point of the body. I mean, everything above and below. I mean, the hips really support the knees, the ankles, and the low back. Really every action we do evolves around the hip because it is that kind of hinge point of the body. The hip itself is also just it's a little bit more of a complex joint with surrounded by a lot of deep, big, powerful muscles. So, it's not just doing flexion, extension. It has to rotate, and bend pretty much, 360 degrees every direction. So there's a lot of opportunity for weakness or tightness to show up in the hip joint. So.
For sure. It sounds kind of like one of those things where if something's a little bit off, it's just sort of like dominoes almost.
Absolutely. Annoyingly so. That is accurate. Yes.
Yeah. So what are, some of the most common reasons for hip pain?
I think because it's such a complex joint, realistically, I think the root cause for a lot of people falls into, weakness. It's all too common because our lifestyle nowadays with, most of us doing a lot of work on computers, a lot of sitting in life these days. These muscles just get weak, and that weakness leads to kind of like you said just a minute ago, imbalance, and things start to just go haywire. Anything from a hip bursitis, which is super common, but I would argue find its root cause in weakness, from gluteal tendinopathies or just your random kind of groin pain. Again, it's so often weakness, with the second issue, probably root cause just being hip tightness, or which the tightness leads to other kind of complications like your hip arthritis and things like that. So weakness and tightness leads to just about everything. We just got to identify what those are.
Yeah. So I'm I know that we have a lot of different people that watch these videos, but I imagine that there are some of these, people sitting here that are listening to you, and they're like, oh, I go to the gym all the time. I can squat 200 pounds. What are you talking about weakness? I'm so strong, but my hips hurt. Could you talk a little bit about the kinds of weakness that you mean, or what might be going on there?
Yeah, definitely. In that particular question, one thing I always like to remind people is that tightness can be an issue as well. So it is identifying one of those two. Now with weakness, I would say all too often, we are doing a lot of bilateral activity. We're sitting on both feet, but that can really result in probably the most commonly weak muscle I see, especially in the hip, arguably maybe in the entire body, is glute med, or the lateral kind of glute that really supports lateral movement and hip stability. And really, a lot of times in our standard action, we don't specifically work that muscle, especially if you're doing a lot of just standard squats and really straight plane activity. So it's an easy one to miss, but it's such a key for stability in the hip joint. So it needs to be addressed, and all too often it's not being addressed in a standard program.
Awesome. So, I guess kind of going off what you're talking about, lots about tightness and weakness. So what are, some common stretches that help a lot of people out with hip pain?
When it comes to stretches, I'm sure so many people are familiar with the good, probably the 2 most common issues I see. Piriformis is one. We have to have that hip rotation is really big. So that piriformis stretch, some people might notice a pigeon stretch is a really important one. And I would argue, even possibly speaking specifically for the hip flexor might even be above that one. And I think tight hip flexors, we all struggle with that, again, because we're sitting so much of the day, and because of that position, they're shortened all the time, and they get tighter and tighter over time. And again, because it's a hinge joint and these muscles work everything above and below, it's such a big player in knee pain. It's such a big player in back pain, everything above and below.
Yeah. So I know like through a screen, you can't really like demonstrate a hip flexor stretch, but like,
Yeah.
can you describe it for us? Like, what does that look like?
There's one, I usually, if somebody's coming into the clinic, it depends on their pain level and where they're at, but a lot of times I'll just start with something really nice and easy where somebody's just laying on their back and taking that leg and dropping it off sliding the hips to the edge of the table or bed and dropping that leg off the side and just really letting gravity do its thing and open that hip up just a little bit. If somebody's beyond that, maybe pain levels are lower or they're a lot more athletic. My second favorite would be a kneeling hip flexor stretch. There's some kind of unique mechanics that go into doing a really good hip flexor stretch, like, making sure we're not overarching through the back or compensating or trying to rotate the hips out of it, which a lot of people do unconsciously. So, always watching for ideal positioning is important to get this perfect stretch. But I think, that they're pretty easy to do once you get it down, right?
Yeah,
but yeah, kneeling or laying is where I'd start.
Awesome. And this is a part where I always like to jump in and remind everyone like tightness and pulling is okay, but if it ever crosses the line into pain, stop. James is not treating you. He hasn't, met you individually unless he has, and then, follow the instructions that he's already given you. But, these are just kind of things that generally work for a lot of people. But if you're having really specific, issues or you're continuing to have pain, go ahead and call us before continuing. So, and kind of going off of that, again, most of what you said, comes back to strengthening. So what are some like exercises or motions that you often see help people who have hip pain?
I think exercises, I always start basic and go from there. So again, it depends on what somebody's individual level is, and we can get really hard and complicated. But my entry level idea oftentimes focuses around, especially we're talking about those two commonly weak muscles, that glute med especially. So that would be like a side-lying hip abduction. Some people might be familiar with a clamshell as well. Those really get into those hip abductors and glute med. There are, again, plenty of ways to make that much more complicated. Lateral or side steps with band walks and things like that. But I think that sideline hip lift or clamshells are a good start. I think another big one is just a bridge, because the glute max or the hip extensors are such a big player there as well. So bridges and sideline hip lifts are where I usually go first.
All right. So, we've talked a lot about like how to address, hip pain and injury. What are some good ways to avoid it?
Avoid injury. I think I think identifying where you have those weaknesses and or tightnesses and making sure you're working on it. I think if everybody were on a pretty steady routine, if I were to pick one muscle we should all be working on, it's probably that glute med, followed quickly by glute max. And again, that's stretching of that. And those are very generic. I think everybody comes in and has a little bit of different presentation, but honestly, those are commonly problematic. So I think, identifying or being aware of those weaknesses and making sure you stay strong. At the end of the day, if we don't get that strength in there and that stability in that joint, every step you take over time is wearing it down in a negative way, and pain will rear its ugly head eventually,
Yeah, absolutely. And, and I do want to also throw in there, I was just talking to Danny at our clinic the other day, and she is one of our patient care coordinators and also does a lot of our marketing. And she's already starting to plan for our runners clinic this upcoming February. So keep an eye open for that. I think that that's also a really good way to kind of be preventative about injuries, because if you haven't done it before, it's really cool. You come in and you walk or run on a treadmill, and then we videotape you on your own phone, and then you sit down with a therapist and talk about it. And so they can help you identify, those points of strength and weakness that, James is talking about here, and kind of talk with you about, ways to mitigate your risk as far as injury goes.
Yeah, that's an excellent tool for sure.
Yeah.
Yeah, if
Sorry to
anybody
tell
has
you
any
about that
questions,
ahead
that's
of
a good
time. I
one.
just like remembered it as we were talking that,
Yeah, I had totally forgotten about that as well. Well, and along those lines too, I mean, if there's ever, um, free screens, we do offer the free screens too. So if there's ever any questions and you can't make it to the runner's clinic, that's
absolutely.
another good opportunity at least to get some feedback and, if be able to see if the PT is an appropriate move to maybe address something that might be underlying there.
For sure. I love the free screens. Like the runner's clinic is really cool, but honestly, like my favorite thing that we do at TherapyWorks is the free screens, because I just think it's such, I know you guys, and if I'm in pain, I can just like call you up and be like, hey, James, this is hurting. It hurts when I do this. Why is that happening? Do I need physical therapy? Like, can you help? And you can give me an answer. But not everyone just knows a therapist that they can call or come in and talk to, or, ask those questions to. And, a lot of times people are kind of expected to know what we can help with without even, talking to us. So I think that, the free screen is such a great tool in that it's only like 10 or 15 minutes of your time. It's completely free, and you can just get answers to your questions and figure out the right next step. If it's physical therapy, great, we can help with that. If it's not, TherapyWorks has been operating in Kansas, in Lawrence, for almost 30 years now. It's coming up on 30 years. So, we know the other resources that are there. We can point you in the right direction. And no matter what, it's completely free, only a few minutes. And after it, you kind of know the next steps to take to help get rid of your pain. So that does kind of bring me to my, next question, which is, how do you know if it's like bad enough to seek help? Like, how do you know the difference between, what's just kind of a normal hip pain versus,
right. First of all, I will tell you, pain is never normal. If you're in pain, that's, so I think we all get too complacent. We're like, oh, it's been aching, but chronicity is a big one, all joking aside here. So if it's something that's been going on for a while and it's just not going away on its own, obviously there comes a point in time when, you probably need to get something looked at. I think, how much is it bothering you? If we're talking, it's just a low grade ache that happens every once in a while, maybe not a big deal. But if this is something that, you used to be able to go for jogs in the afternoon, now you can't because every time you do, the hip flares up, or, you used to be able to get down and play with your kids on the floor, and now you don't because every time you do, the hip flares up, right? I mean, if it's impacting your life and what you like to do, don't just let that sit there. I think too often we just kind of let these things go, hoping they will go away. More often than not, that does not work. They do not just go away on their own. So I think being proactive is important. Like I said, the hip joint it's a major hinge point of the body. So if there is weakness and tightness and pain, that joint is going to be taking a lot of pressure, and over time, it's going to break that joint down. You catch something early, we get it kind of worked out, re-strengthened, stretched out if we need to. And hopefully we can eliminate those symptoms and prevent any progression of negative injury, whatever that underlying injury might be.
Awesome. Yeah. And I mean, like we talked about earlier, if you have any questions or if you're not sure, it's free to talk to us. So go ahead and give us a call.
It is handy for sure to be able to just pop in. And honestly, they're short enough that we can squeeze them in to our schedule pretty easily and get somebody in and answer those simple questions and help them decide if PT is the right move or the right fit for them. I don't like to make any promises, but we can usually get you in within 24 hours to talk to somebody. Yeah, I would say that's a safe bet. 99% of the time. We are busy, but we like to make the time for that. So we try to make a point to get people in when we can, as soon as we can. Awesome. All right. Well, lots of great advice today, James. Do you have anything else you'd like to add before we sign off? Putting you on the spot there. I think just stay moving, stay healthy. I think if there is pain there, I think all too often we all need a little encouragement. Hey, get it checked out. Don't just wait and wait until that pain just gets worse and worse. I think the earlier we catch things, the easier it is to stop, and we don't cause any further underlying damage, right? So don't wait. Get help if you feel like you need it.
All right. Thanks so much, James.
Awesome. Thank you.
All right. Take care.
You too. Bye.